The COVID-19 pandemic is an experience the world will never forget. It caused us to change our ways of life for the past year or so. People had to give up sports and hobbies that required physical contact and avoid large gatherings with family and friends. As this current year progressed, people started to share what this pandemic meant for them and what item represents their pandemic experience. Some of their answers include laptops, social media, notebooks, or any hobbies that they acquired during the pandemic. However, others use this pandemic to shed light on medical injustices that have been hidden for so long. The most apparent is the residential segregation that occurs in the United States. According to the University of Cincinnati's Department of Sociology, residential segregation is defined as the spatial separation of two or more groups within a specified geographical area. The determinants of this spatial separation include race and ethnicity, place of origin, socioeconomic status, family structure, and religion. Residential segregation typically benefits the ethno-racial majority groups and the affluent, but harms the minority groups and the poor. In the United States, there's an additional divide: urban areas versus rural areas. According to Georgetown University's Health Policy Institute, rural Americans are consistently less prosperous than urban Americans regarding health care. Pre-pandemic, rural Americans had 20% higher overall death rates than those who live in urban areas due to their lower rates of insurance, higher rates of poverty, and more limited access to health care, according to the Centers for Disease Control and Prevention's 2019 National Center for Health Statistics. Compared to their urban counterparts, rural Americans have to travel further distances for primary health care because most rural areas are underserved by primary care physicians. These inequities are used to make urban Americans seem healthier statistically, but there hasn't been any effort to fix them.
And rural hospitals tend to have lower days of cash on hand, higher rates of negative operating margins. So they have been struggling traditionally. Then when a pandemic like COVID-19 comes along and they need to essentially pivot on a dime and close down service lines that tend to bring in revenue, such as surgeries and outpatient services and emergency department visits, they don't have the economies of scale to be able to rely on other sources of revenue that have come in.
Now, COVID has only solidified and proven more that access to healthcare is worse in rural areas and certain communities. Rural areas also have a limited supply and low access to vaccine shots, but officials like to blame the non-vaccination rates on anti-vaxxers. However, only 41% of people in rural areas are vaccinated, whereas in urban areas, 53% are vaccinated. On top of that, the nursing shortage is by far worse in rural areas due to other hospitals offering higher pays, so the current nurses working in rural areas are leaving for more money. As a pre-nursing major, the nursing shortage is one of the reasons I chose to become a nurse, because I truly want to help anyone and everyone. So when I do become a nurse, I hope to help these rural communities. Without us nurses, the rural hospitals are predicted to have even more closures, which will continue to increase the mortality rate. And the bed capacity has also come down due to the nurses refusing to work without a higher wage, so patients have been sent home even though they should not have been.